Chief Consultant of ayufy. So we all are synonymously using PCOD and PCOS. And do you know exactly what is PCOD? Even though PCOD is known as polycystic ovarian disease, often used that I already mentioned interchangeably with PCOS, but it's generally considered as a broader term for various ovarian dysfunctions. But in this PCOS means polycystic ovary syndrome. The PCOD is polycystic ovarian disease, but the PCOS is polycystic ovarian syndrome, a hormonal disorder causing enlarged ovaries with a small cyst on the outer edges, especially more than 10, around 10 cysts is considered PCOS. And PCOS is a hormonal disorders causing enlarged ovaries with a small cyst, and which include the symptoms like irregular periods, excess hair growth, acne, weight gain, etc. symptoms. And the main cause is a hormonal imbalance and the insulin resistance, wherein the PCOD conditions characterized by multiple small cysts in the ovary and irregular absence of periods, acne, hair thinning, weight gain, and exact cause is usually not clear, but we all are blamed for our hormones as a key factor for that reason. And also, it's not as a sedentary because of the sedentary lifestyle is happening. And based on the symptoms, blood test, the androgen levels, and ultrasound, PCOS can be manifested the same way during the blood test and the that's why we interchangeably using this both PCOS and PCOD. And while speaking the prevalence, 1 in 10 of the Indian women have PCOS, and compared to PCOD, it's known to be 2 out of 3 ladies in India is having PCOD, which means PCOS is somewhat rare compared to PCOD, but we can say it as rare because it's 1 in 10. These are the cartonic manifestation of PCOS. What happening because this is a structure of uterus, and here the ovary is having multiple cysts. And this is the female reproductive hormone production, that is steroidogenesis. From the cholesterol cells, some sort of chemical reaction is happening in our body, and it's a steroidogenesis, which means the cholesterol. From the cholesterol, some reactions are happening, and from the androstenedione, which means it's somewhat similar to androgen hormones in male, the estrogen is producing. That's why when any issues is happening in between the reaction, the process of preparing or producing the estrogen, it might be, overproduction of the androgen will be happening. That's why, because in the most of the male is having androgen related alopecia because we all used to call it's symptom of, masculinism. That's why they are having baldness or alopecia. The same situation is happening in the female in PCOD is because of the overproduction of androgen hormone, which is to be usually prevalent in males. And because of the okay, because of this androgen increased count in our body, most of the female when have this PCOS or PCODs having certain symptoms, that is excessive hair growth over our face, especially in the mustache and beard, and baldness, especially in the frontal area, the hair fall will be there, and it will be reducing the hair count in the frontal area, that's from the forehead. And weight changes and troublesome losing weight, ovarian cyst in USG like test reports, and low sex drives, irregular or missed periods. And sometimes the client used to complain like they'll be having, even though they have a regular periods or regular cycle of periods, they'll be having scanty blood flow. Sometimes at the same time, some complaints like they are having heavy blood flow. Both the condition can be seen in PCOS or PCOD. And I already mentioned male pattern of baldness and thinning of hairs. And high testosterone level can be seen in the test reports. Insulin resistant. In most of our clinical practices, doctors or when the clients or patients are coming towards us, whenever they are having PCOD or PCOS, if we check their blood glucose level, they'll be having high glucose level in the blood. So that's why you might have experienced whenever you visited for any allopathy doctor before for this PCOD or PCOS management, they might have give you the glimepiride tablet. And the fatigue, acne, mood changes, troublesome conceiving of infertility. Most of the female recognize that they are having PCOS or PCOD during when they get troublesome for conceiving. Because sometimes we used to call it as silent PCOS because there is no symptoms of any evidence symptoms can be seen in the physical body like acne. We used to call it as heavy acne in the face or body, neck. They have the acanthosis nigricans like blackish discoloration, and they have thinning or male pattern of baldness. They don't have any of the symptoms, but they find difficulty in conceiving whenever they used to consult an allopathy, an infertility specialist. While in the examination, they could understand that they are having PCOD, that's a polycystic appearance in the uterus. This is the appearance of polycystic ovary in the uterus, a pictorial representation for getting better understand for you. How we can reverse or control PCOS? Actually, PCOS is somewhat difficult to reverse compared to PCOD. And it can be reversed or it can be controlled with the help of food, lifestyle, and medicine because it's a lifestyle related diseases. And what all are the food to be included? Mainly low glycemic index or GI foods should be added in our food, especially carbohydrate and sugar to be reduced in our diet for reducing or controlling the PCOD. That's whole grain like barley or brown rice can be included instead of white rice. And legumes like lentils, chickpea, black beans, and green gram that can be used. And non-starchy vegetables like broccoli, spinach, kale, bell peppers can be included in our food. High fiber foods like, especially the fruits like berries, apples, pears, orange, and vegetable like Brussels sprouts, avocado like vegetables, and leafy vegetables are also the best uh, vegetables that can be included in our food. And lean protein like the salmon, mackerel, sardines can be included in our food. And chicken and turkey can be used only the protein part of these chicken and turkey can be used. And plant protein like tofu, omega-3 fatty acids, flaxseed, chia seeds, walnut. And nowadays there are revolutionary change are happening. Most of the people are using the flaxseed and chia seeds and walnut, and monosaturated fat like olive oils, avocado, and almond. And for the Kerala peoples, due to the climatic conditions, coconut oil is somewhat helpful for them. That's what we in our clinical practices used to understand the lifestyles. And anti-inflammatory foods like spices, turmeric, ginger, cinnamon. Cinnamon is having a capacity to reduce the blood glucose level in our body, and turmeric is having the capacity to reduce the inflammatory conditions. Fruits, we already mentioned the blueberries, strawberries, cherries, like berries can be included. Nuts and seeds like walnuts, flax seeds, chia seeds, and complex carbohydrate like sweet potatoes can be used instead of this. Sweet potatoes can be used instead of this normal potato if one is very
तो
brown or
बड़ी बड़ी
fond
किसी का
of potatoes.
पेमेंट है आपने उसको कैश दिया होगा
Hello? Okay. Pumpkin squash like foods can be used, whole grain breads, whole wheat pasta when they are, if any persons are not lived in our country, they can have these kind of foods. And fermented foods like yogurts, kefir, sauerkraut, kimchi can be included in the food. And food to be avoided in the diet, refined the high glycemic index food to be included. Whenever any patients approach me for a diet, proper diet to be instructed to them as in a PCOS or PCOD management, I always suggested that to everyone is having facility to check in the Google. So if you are experiencing a new food, you have to check the carbohydrate value, glycemic index value, glycemic load. These three things of a food you can easily check in a Google. And if it is lesser the value, you can easily, without any doubts, you can take the truth. Because whenever it's increasing or they are having high glycemic value, a high glycemic load, and high carbohydrate value, there is a chance to get PCOD because of that, or your PCOD will be easily getting aggravated. And processed food to be avoided, and trans fat and saturated fats like fried foods, fast foods, processed meat are to be avoided, and high fat containing foods are also to be avoided, and especially the dairy products like high fat milk. If anyone is highly requiring the fat, they can use a skim milk. And caffeine and alcohol, processed foods like chips, cookies, instant noodles, whatever we are available in the supermarket or somewhere else, like they have to avoid, and artificial sweetness and coke, etc. Then next, lifestyles to be included. Exercise. The first, second, and third most important of the lifestyle is exercise. Because as I already mentioned, the steroidogenesis of the hormonogenesis of the production of estrogen and progesterone only because of to understand how the cholesterol is converted to estrogen and progesterone. For converting that process, usually the exercise like activities will help you to convert that cholesterol of our body to normal estrogen and progesterone. Otherwise, it might be, stuck with the production of androgen, or somewhere else it will be blocked. That's why you are getting this PCODs like issue. So you have to be very cautious about your exercise level and regular exercise activity. At least you have to aim for a 150 minute of aerobic activities or swimming, cycling, skipping, like whatever you are fond to practice. And yoga asanas that also you can be practices like focus on flexibility, strength, and relaxation for your body. And Surya Namaskara is one of the best yoga asana that you can adopt in your daily life. Then high intensity interval training also will be helpful for your PCOS management. Then the next is stress management. If you're having stress, of course, your body will be producing the endotoxin that will again cause you to have the PCOS like issues. So you have to be very careful to manage your stress management, and it is very difficult to manage stress in our current era. So you can practice mindfulness and meditations like practices for the 10 to 20 minutes, like we can practice pranayama techniques like that is somewhat similar to deep breathing exercise and progressive muscle relaxation techniques, etc. And sleep, aim for 7 to 9 hours of quality sleep a night. If you are not getting a proper sleep, that indirectly reaching to stressful condition in your body and mind. Thus, it will be leading to PCOS. And you have to find at least some time for a leisure activities in your daily routine to manage your stress level. Then lifestyle habits like hydration. Drink at least 8 to 10 glasses of water per day. That will help you to improve your metabolism, your body metabolism. And herbal tea like chamomile, like you can use these kind of essential oils. Otherwise, I can give you a simple remedy, like you can have cinnamon, the cumin seeds, and you can add clove in your, and you can powder them, roast and powder. You can have it in your daily black tea. Instead of black tea, you can have these powders. You can have that herbal tea along with the ginger or dry ginger. That will help your fat metabolism. and this will help you getting, uh, control the PCOS and avoid smoking. Regular health checkup you have to do to check up at least your blood glucose level, and it should be fasting and postprandial sugar levels, and also you have to check the 3 months glucose level, that is HbA1c, and the cholesterol and the blood pressure regularly. The regular consultation with a healthcare provider for personalized advice to be there, and healthy weight management. Anyway, it's a this polycystic ovarian disease or syndrome. The mostly the cyst is because of the fat accumulation in the body. So you have to be very cautious about a healthy weight management. So focusing on the maintaining of the healthy weight through the balanced diet and regular exercise to be there, and avoid crash diets, because you have to select the best possible diet according to your body that should be customized for your health condition. How Ayurveda or how ayufy will help you? Ayufy is an online platform which provides you the online consultation in gynecological diseases, especially the women health care and infertility. So we have plenty of doctors which are expertise in this field. So we'll be providing the online consultations for you and your body. We are giving individualized or customized treatment plans for your body. So let's discuss your doubts regarding the PCOS or PCOD management. Please let me know if anyone is having any doubts regarding the PCOS and PCOD management. Moreover, in Ayurveda, we have a lot of uh, treatment plans, and we include a lot of Ayurvedic herbs like Shatavari, Brahmi, turmeric, Ashwagandha, like medicinal product in our medicines, and it should be a proper treatment plan for you accordingly, because I already mentioned in some different symptoms can be seen in different person, like some is having suffering from heavy bleeding, some usually suffering from scanty or irregular menstrual cycles, and some usually struggling with the associated symptoms of the PCOD. And most of the ladies who are after marriage time will be recognizing the PCOD only because of they are not able to conceive the kid. So in Ayurveda, it's focusing a patient as an individual and will be giving the treatment according to the body conditions.